A trifecta of viruses infecting a lot of North Texans right now. Chances are, if you're not sick, you know somebody. COVID-19, flu, RSV. Word now, strep throat. That's on the rise as well. We're told the uptick right now, largely because of recent holiday gatherings. Nick Starling, live outside Parkland. We're going to save you a copay today because you went in to get some free doctor advice for us on how to navigate all this.
Hey, Doug, doctors say they are seeing all kinds of people come in with an array of sicknesses. And as you mentioned, Doug, they say it's because we all gather around in the holidays and let our guards down. They just urge everyone to be cautious. The post-holiday seasonal sickness is here. While this year is different.
COVID a year ago, right? We were talking about hundreds of Omicron cases admitted in the hospital. And today we're at about 30.
COVID is still around with a new variant called XBB 1.5.
It's very transmissible, and a lot of people have minimal symptoms. So some people get exposed and have just what they think are allergies or colds, and then give it to somebody who gets more severe reaction.
According to the DFW Hospital Council, which looks at data from 90 hospitals in North Texas, nearly 1,000 people are hospitalized today with COVID-19 and about 270 people with the flu. They're calling it a spike, not a surge.
And there's no secret to why these things spread, right? It's when someone's infected, they get around people who aren't infected, and the people who aren't infected don't take precautions.
One reason doctors say more people are coming down with these illnesses. People aren't getting vaccinated.
I think people are just tired of hearing about vaccines and getting shots and things like that.
RSV cases have been a problem for kids, and now strep throat joins that list.
The pediatricians are still seeing an increase in strep throat over the last 2 years because kids are back in school and kids aren't wearing masks.
Doctors say don't show up to the emergency room unless you have a temperature of 103 or above, or you're running out of breath doing regular everyday things. And most of these illnesses can be treated with over-the-counter drugs, and also, if you want to protect yourself or others, to wear a mask. Live in Dallas, Nick Starling, CBS 11 News.
Nick, we thank you. Seeing more and more masks nowadays. Do what makes you comfortable, right?